Greetings from Brain, Spine and Joint Clinic, and this is the second topic of our neurological rehabilitation series, and the topic is very vast and it is like something which needs to be addressed much more in depth and much more in quality and content because there are certain issues which keep on happening because of lack of knowledge, because of lack of availability and accessibility of good physiotherapists for their rehabilitation. And the topic for today's discussion is spinal cord injury. Spinal cord injury, for today's topic, I'll be picking up for the traumatic spine injuries, and later on we'll be going for the non-traumatic spine injuries. Now, coming to the traumatic spine injury, what is a spinal cord injury? Spinal cord injury is a traumatic lesion to the cord of your spine. Now, what is the cord? Cord is the neural elements or the neural structure which passes between the spinal column, and it gets dissected, lesioned, disturbed, cut or injured, and hence the information it carries, both the motor and sensory, are impaired. So spinal cord injury is an event in which there is a neurological lesion to the neural element of your spinal canal. The spinal cord is the important and integral part of the nervous system. We all know this, and it deals with the motor functions, sensory functions and other autonomic nervous system functions, which includes temperature control, digestion, sweating, bladder and bowel sensation and their function. So a spinal cord injury can happen to anyone at any level. So when we talk about the spinal cord injury, we are going to talk through this model, which will be helpful for our better understanding. This is our spinal cord. It is connected to the skull, the base of the our head bone, and then in between there is the brain. Now brain and the cord are the part of the nervous system. Any information which is given to the brain or is coming from the brain happens to pass through and integrate in the spinal cord itself, and then it is distributed, or the information is gathered from the muscles, visceral organs and other somatic structures, and then it passes back to the brain and vice versa. So these are the emergent roots of the spinal nerves which are in pair throughout the column, and there are 8 pair of spinal nerves in the cervical section. This is the cervical section and it contains of 7 bones, but there are 8 pair of spinal nerves. Till the 7th bone of the cervical column, the nerves originate just above the bony element, which is the vertebra, and just below the 7th vertebra there is origin of the 8th spinal nerve, and henceforth the rest of the spinal nerves originate from below the vertebral body. So the cervical column has 8 pair of the spinal nerves. The thoracic column has 12 pair. There are 12 nerves, 12 pair. The lumbar column has 5 bones, 5 pair of nerves. The sacral has 5 again, and the coccygeal has only 1 spinal nerve. So what happens in the spinal cord is a dissection, cut or injury to the spinal cord, and hence the information below that level is impaired or absent. Spinal cord injury can result in a variety of complications and a variety of effects depending upon the magnitude of injury and the extent of injury in the spinal cord. By magnitude, I mean the kind of force which has disturbed the spinal cord, and the amount of injury or the complications it has created in the spinal cord. It can result in motor dysfunctions, sensory impairments or sensory loss, disturbances with the bladder and bowel, disturbances with the respiratory system, complications and disturbances related to the digestive system, reproductive organs, and hence the patient who has received or has attained the spinal cord injury is not optimally functioning, is not functioning at its peak efficiency, because the participation in the daily life is impaired. He or she has difficulty in doing the activities of daily living. He or she may have difficulty in communicating with peers, in respiration, in maintaining a erect posture, or may have other complications like related to the nervous system, which include the bladder and bowel, which include the digestive system, and complications like pressure sores and spasticity. The overall participation of that individual is disturbed, and hence the quality of life is degraded if not treated well and if not rehabilitated well. In this spinal cord, the injury is divided into two categories. One happening in the cervical region, which disturbs the function or impairs the function, or we can say it makes the function absent in the upper limb, that both arms, your trunk, front and back, and lower limbs, and hence the patient may also have complications related to rest of the visceral organs below this level. So this category is called the tetraplegia or quadriplegia. Quadriplegia was an older term being used. Now the other category which happens because of the injury in the thoracic column, which is this mid back, in the lumbar section, or the sacral section of the vertebral column, or the neural component. So that is known as paraplegia, in which it is usually paralyzed below the waistline. Hence the functions below your chest or waistline are disturbed, which may or may not include total absence of function in the bladder and bowel. So that those are known as the paraplegics. Both of them do have difficulty in walking and mobility, which is of prime care. Both of them have absence of function or difficulty in bladder and bowel, and both of them have spasticity, which again relates to the magnitude of injury, which again relates to the physical manifestation of the neural injury. Now, these were the two categories which are found in spinal cord injury. When we talk about the causative factors of spinal cord injury, a lot of them, and a very commonest across the world, is road traffic accidents, which can be from bike, which can be from overloading of the vehicle, as found in most of the developing countries, which can be found in because of the four-wheeler or a big vehicle hitting your vehicle, or you hitting the big vehicle. Any kind of RTA, road traffic accident, stands out to be the number one causative factor or risk factor for spinal cord injury. The other second on number is fall from height. Fall from height can be from falling from any height, which could be a building, which could be an electricity pole, which could be a tree, depending upon it depends upon the region, and hence it affects the population living there. For example, somebody living in a rural area may have a fall from a tree, and somebody living in an urban environment may have a fall from a building. Anything can happen, but both of them come in the category of fall from height. Across the world, there are approximately 20 million cases which are added per year with spinal cord injury of different extent, of different magnitude. because of the trauma, physical trauma happening to the spinal cord. And this was according to the survey which happened in 2014. This was a study, multicentric study, which compiled it to be 20 million cases per year are added. And if we count about India, there are lakhs of cases, approximately 1 lakh minimum of it, which is added to the population of SCI every year. So far we have talked about what is spinal cord injury, what happens in spinal cord injury, and what are the causative factors, the two major categories of spinal cord injury. Now we are coming to the brief about pathology of spinal cord injury, what happens in the pathology of the spinal cord injury. So I'll be addressing spinal cord injury as SCI. In SCI, what happens is because of the immobilization, because of no movement, because of lack of function, there is no effect of gravity, because most of the time the person with SCI is lying or sitting, and the anti-gravity effects which the body has to do, the anti-gravity efforts which the body has to maintain, be it muscle or a bone or our skeletal system as a whole, are lessened or absent. Because there is no usage of the present cells, there is no demand for making the new cells, and there is no clearance or elimination of the toxins being produced and the old cells being worn out. Hence, there is breakdown in the physiological process of this building and rebuilding, and it happens inside the bone, inside our musculoskeletal system, and in the muscles itself. Also, there is stagnation of fluid, be it blood, be it lymph, or the natural mucus found in our organs, and because they are not moving, they are stagnant, then they become the house of infection and further complications leading to respiratory diseases, which includes pneumonia, skin breakdown, which includes pressure sores or bed sores, commonly known as, and which includes atrophy of the muscles and calcification of different areas, which we never have thought about that this area could get hypertrophied like this in such a way, or the muscle could have deposits of calcium and it can become as hard as a bone, and complete atrophy or wasting of the muscles, which is visible in the hands, in your thigh muscles, in your arm muscles, in your upper body, in your muscles of your bums. So this is something in brief about spinal cord injury. In our coming videos, we'll be discussing about different complications and their best possible treatments, options which are available, both the recent trending ones, the advanced treatments available, and the traditional old school effective methods available for the management and decreasing the complications related to spinal cord injury. Thank you for listening. You can put up your queries in the chat box here, or you can comment us or write to us, and do follow us on our YouTube, Instagram channel and Facebook. Thank you for watching. Take care. Bye-bye.